I'm Bill Virtue and have been a member of the Academy for, 20 plus years, and have worked my way up through it, and now I'm very pleased to do this twice a year, present the fundamentals of Mercury dentistry. I practice in a very small town called Yadkinville, North Carolina. Been there for 43 years, and I think our population is about 3,500. And our patients come from all over the place. They come from Virginia, they come from South Carolina, they come from up in Tennessee. So if anybody says what we're going to talk about this weekend can't be done in a small town, it can be. It's just a matter of doing it. I'm an alumni of the Pankey Institute, and that was one of the creeds we had, because the dentistry they teach you there can get rather expensive, and it's always, oh, I can't do that in my town. Well, you can, trust me, you can, because what happens, people come to find you, and we'll talk about that in a bit, but they come to find you on the internet, and that's the route that these folks come in from, and I'll talk a little bit more about that later. But anyway, I'm glad you're all here. It got a little too hot in Phoenix for my coat, so I decided to take that off to begin with. I worried about walking over here with it on, but at any rate, we'll get started. As soon as I figure out the pointer, we're rocking and rolling. Okay, it's Mercury 101, and what this slide is going to show you, as all of you have seen 100, maybe 1,000 times for sure, there's dental terms for what Mercury-Free, Mercury-Safe, biological means, but Mercury-Free is, you don't place mercury fillings. We call them, you might call them amalgam, we call them mercury amalgam, but they're basically 50% mercury. And a large part of dentists today are doing that. They're not placing mercury fillings, but in our opinion, they're not removing them in a safe way. So called mercury-free is not necessarily a good thing for the patient. In fact, it can be quite bad. The other thing people sometimes will say is, well, you got fluorescent lighting, there's mercury in your lighting, so how can you be mercury-free? We've replaced all of our lights, not because of that reason, for energy, with the diode fluorescents. I won't call them fluorescents, I guess they're not anymore, but same shape. Mercury-Safe means that you have a rigorous program to remove the mercury vapor from the patient's mouth before you breathe it and your staff breathes it and the whole office gets it. Now, this is what we're going to teach today or this weekend for sure, and we'll have slides on that later, but you've got to remember that when you're removing a mercury filling, whether it's one or a quadrant of them, if you're sitting out without protection, the dentist and the assistant are there, let's say 8 hours a day, not doing the same thing all the day, but you get my point. So you're breathing mercury vapor in at a very concentrated level. Now, our goal was to protect the patient, but in a selfish way, we're protecting ourselves, our staff, and us. Now also think about this. Mercury vapor, once you take the bird of that mercury filling, the mercury vapor will fill the room. It gets picked up in the air conditioning system, and the front desk gets it. The hygiene get it. The patients in the waiting room get it. Everybody's getting mercury vapor from removing one mercury filling. So that's an important concept. Mercuries are biological compatible, or biologic or biocompatible. It means that you're using techniques that you put back in the patient's mouth what's biological good with. In other words, you don't put things that are toxic to them or they're possibly allergic to. Many of our patients choose to get allergen antibody tested so that whatever we put back in their mouth is compatible with their body. So it's not always about mercury. That's one concept. But some of the composites have bisphenol A in them. You don't want to do that. Sometimes these agents, whether it's etching or bonding agents, have a compound in it that the patient will react to some small degree, maybe a large degree. So you can do blood testing for this. Physicians do it, we don't do it. And it's sent off to a lab, and then we get a report back. I guess it's 3,000 dental products. My assistants go through that, and then we decide what we can use and what we can't use, from the etching agent to the bonding agent, the cement, everything. We've got it down to a science now, having done it for so many years, that we rarely find a patient that's not okay with our standard protocol, because we just use things that aren't going to be reactive. The World Health Organization Mercury in Healthcare report, it may cause harmful effects to the nervous, digestive, respiratory, immune system, and the kidneys, besides causing lung damage. Adverse health effects from mercury exposure can be tremors, impaired vision, hearing paralysis, insomnia, emotional ability, a lot of things. Now, you can't always say that, that's causing that exactly, but these things, mercury vapor has caused these. Whether it's going to cause it in your patient, who knows? I'm allergic to poison ivy. You may not be. So people react to different ways. Now, over the years, and you've had the same thing happen, you have a patient come in, they're 90 years old, they've got a mouthful of amalgam fillings, as healthy as they can be. Somebody else will come in after having 2 or 3 mercuries placed a year ago, and now they got symptoms of multiple sclerosis or some other neurological disease. The way I got into this years ago, I'm from South Jersey originally, around Philadelphia. I was born in Camden. So my whole family was from Camden. Anybody know about Camden? Yeah, don't go there. Terrible place. Good place to be from. But at any rate, we were living in North Carolina for the last 43 years. My mother's sister, Aunt Vi, came down to visit 20 plus years ago, and she had Lou Gehrig's disease. Very, very nasty disease. And she laughed all the time, always laughing. And every time she did, she opened her mouth and she'd see all these black fillings in there. Well, I didn't know anything about it. But she had MS, Lou Gehrig's, and then two of her children, my cousins, all 3 of them died of Lou Gehrig's disease. So it's like, man, this is my first cousins and my aunt. Either I got to find a different profession, or I've got to find out how to do this properly. So instead of quitting dentistry, I decided to join the IAOMT and find out how to do it. So except for needing to replace right hip, I'm so far healthy, but maybe mentally deranged, I'm not sure. Probably have to be after 43 years. So the sources of human mercury exposure, what this is showing is that the greatest component of our exposure, this is mercury fillings right here, dental amalgam. And you can see we're all concerned about fish. I don't eat a whole lot of fish. My fiance loves it, but I'm okay with it. I'd rather have a steak. But even that's not that big of a chunk. Air and water, yeah, you can see it right here. Other foods, so you can see that pie, most of it's coming from our mercury fillings. It's because once you place that filling, every time you brush, every time you clench, grind, you drink hot coffee, mercury vapor comes off that filling, and you inhale it. So that is the exposure. It's not just sitting there inert. It's evaporating or off-gassing mercury all the time it's in there. And this is an old slide. I always enjoy this one. A little bit. There was a couple, 3 different amalgam wars over the years. And amalgam fillings have been placed in millions of teeth, as we know, for a couple hundred years. In the 1850s, the American Society of Dental Surgeons banned the use of mercury fillings. They knew that mercury was not healthy. Well, back in those times, the only other choice was gold, and a whole lot of people could afford gold fillings in their teeth. Either you gold filling or a tooth comes out. So a lot of dentists said, hey, we can't do that. So they started using the mercury fillings, and they were known at the time as quacks by the American Society of Dental Surgeons because they were using what Germans call quacksilver or mercury. So it's interesting now, well, it was several years ago, we were the ones that were quacks, and the ADA formed out of the mercury-using dentists who actually were the first quacks. So it's a little bit of reversal. Oh, wait a minute, I think I missed a slide here. Okay, yeah, here we go. Okay, now you all have heard Mad Hatter's disease, Alice in Wonderland. Well, to make felt, which was very popular back in the 1800s, early 1900s, felt hats were very popular. But to make felt, you take wool and you stir it in a boiling vat of mercury chloride. Well, after you're standing over there stirring this with your paddle, you're absorbing a lot of mercury. The mercury's boiling, and it off gases at very low temperatures. So Mad as a Hatter came from the mercury vapor these people were inhaling. And it was banned, as you can see, in 1941, but I don't know why we're still using it today. I mean, it used to be, when I was a kid, we'd drop a mercury on the basement floor and watch it splatter. Break thermometers, no big deal. Well, if you break a mercury thermometer in a school today, I don't think you'll find one in a school, but if you did, you'd have to evacuate the school building. That much mercury would be a hazmat experience. They'd come in and decontaminate the entire school because of that little bit of mercury. And that much mercury is in your fillings in each tooth. So think about that. Significant dates in dental amalgam mercury, okay? 1984, National Institute of Dental Research and the ADA acknowledged mercury might be released from amalgam fillings. Well, we know it is. We can show that. In 1986, the ADA enacted a resolution, still part of the Code of Ethics today, prohibiting dentists from removing mercury fillings because of toxicological reasons. Well, yeah, I don't ever tell anybody they got to get their mercury fillings out. There's no way I'd ever do that because that is kind of an unethical thing to do. But they come to me wanting them out. Fine, we can take them out. And we interview them, find out what their goals are. And I want mercury fillings out. Okay, good. Then we treatment plan, whatever we got to do, composite or on porcelain onlays. We do a lot of CERAC in our office, which has been a godsend, by the way. I've fought tooth and nail to avoid it 20 or so years ago because of the expense. But man, that is the chance to change our life doing CERAC and the patient's life. They come in, they get numbed, they get their crown in one appointment. Don't take off work again, don't get numbed again, no leaking temporary. Ugh, beautiful. I do them all the time. I like doing it. Then because it makes the patient healthier. Yeah. The FDA's Center for Devices and Radiation Health officially classified dental amalgam as a Class 2 device, meaning it's not very much of a problem. You know, go ahead and use it. It won't hurt anybody. The EPA standards went into effect to limit discharge of dental pollutants into our drinking water. Now, what people don't realize is that it's been estimated between 40 and 60%, I've seen both figures, of the mercury in our streams and rivers come from dental offices. Because what we're doing, we're sucking that saliva, mercury vapor, mercury particles out of the mouth with your suction hose, goes into a trap, the big chunks collect there, the water, we'll call it water, slurry, goes down and out into the public sewer system. Or your septic, I don't think anybody's got a septic tank in a dental office, but it goes into the public sewer system. So now it's back in the environment. I'll have a slide on that later. So it's been mandated in North Carolina several years ago. I don't know how hard they enforce it to have mercury separators. We've had one for over 20 years, and I'll talk about that a little bit later. But it actually removes 99% of the mercury from the slurry that you suck out of the patient's mouth. Okay? Now, people don't realize that, but that's a lot of mercury going into our streams and rivers. The United Nations Environmental Program in Minamata Convention with Griffin Cole was one of our representatives there several years ago, is a global treaty to protect human health and the environment from the adverse effects of mercury. The treaty aims to phase out and phase down mercury use in a number of products, processes, and includes phase down on dental amalgam, okay? It has been ratified by over 100 countries, including the United States. And the convention was held in August of 2017. Now, I don't know that there's been anything, maybe one of our guys in the back would know if there's any been progress with that. I haven't heard of anything. There's been no push in America, United States, to ban it. The ADA is actually opposed to anything like that. And I like in the ADA's position, because I live in Winston-Salem, North Carolina, where R.J. Reynolds was from, and they've since been bought and sold, but they're still manufacturing of cigarettes in our area, and a lot of tobacco growers. But the ADA, Reynolds Tobacco for years covered up the addicting effects of nicotine. Okay, they just wouldn't admit it. They had the research, they knew it was, and they also knew the damage of nicotine and tar to the human body. But they covered it up. They didn't want to talk about it. It didn't exist. Well, that's kind of the same thing I think my personal feeling is about the ADA. They know it's true, but they can't admit it because they've been denying it for so long. To admit it now would be going, well, good God, the research has been there for 20 years. What have you been sitting on? So, you know, I'm not a member of the ADA because of that reason. I think that they need to be upfront and actually admit what's going on, but that's their business. Regulations in Europe. European Parliament ruled as of July 18, 2018, that dental amalgam shall not be used for dental treatment of deciduous teeth, children under 15, pregnant or breastfeeding women. They also called for reporting on the feasibility of a phase-out by 2030. Now, one thing we do not do is remove a mercury filling on a pregnant or nursing mother. Now, mom can go home and pump milk, and then we can come back and do that, but we don't encourage it. Now, she's got an emergency Yeah, we'll take care of that tooth, but we don't go in and remove a quadrant amalgams on anybody that's pregnant or nursing. So that's not a good thing. Wait till they stop, wait till they're, after the birth and everything's cool, but that's too dangerous, in our opinion anyway. Regulations in the U.S. The U.S. Food and Drug Administration currently does not have any enforced regulations. However, in 2020, the FDA finally updated its recommendations by warning certain high-risk groups to avoid getting dental amalgam removal. The ADA specifies that the group may be a greater risk for potential harm. Now, that's pregnant women, okay, with developing fetuses, women who are planning to become pregnant, nursing mothers, children, especially those younger than 6. I don't know why it's important that they be under 6 or 8 or 12 or for any year, but anyway, I'm glad they at least acknowledged it. People with pre-existing neurological diseases such as multiple sclerosis, Alzheimer's disease, or Parkinson's. People with impaired kidney function, and people with known height and sensitivity. Now, we have a lot of patients that come in from functional physicians, alternative physicians, who these patients will have some kind of neurological problem, and they may have MS, Alzheimer's, or anything. I mean, there's all kinds of different things. With a request to get these mercury fillings out. Well, we do, but we do it very judiciously. We don't go in and just remove a whole quadrant. We might remove 1 or 2 and then come back and 2. Because sometimes, even with the best of care, some of these patients get sicker for a while if you take out too many mercuries too fast. Because there is some absorption. As hard as we try, it's not 100% absorption. I mean, we can't get 100% of the mercury out of the patient's mouth. There's some there. And we also breathe some, even though we don't want to, but it happens. But we're doing the best we can with what we got to work with. Over the last 20 years, I know when I first started coming to these meetings, I came once a year. Now I've got to come twice because of board meetings and doing this, and I'm glad to be here, trust me. This is like my extended family, this group is. I went all through Pankey, and I had a lot of friends that we just, every year we got together, and it was like a family. But these guys I've been around forever and ever and ever, and it's one of the meetings I really enjoy coming to. And it's always, what a nice hotel, huh? Yeah, they did good on this one. Back when they were talking about Michael Ziff, my first meeting was in Las Vegas. Actually, it was in Durham, North Carolina. And it was the dumbest, junkiest. I drove to it because I'm only an hour and a half away. I drove to it. And I'm telling you what, this hotel was like a dungeon. And I was around these people, like 20 in the audience or so, and they were talking about these concepts, and I'm going, you guys are completely nuts. I mean, no plastic, no acrylic partials, and there wasn't any talk about dentistry. I mean, there's no talk about margins or impression materials or technique, nothing. It was just about this goofy science we're talking about. And I came away thinking, man, these guys are weird. I kind of call them the Birkenstock crowd because they had ponytails and they wore Birkenstocks. And I'll tell you what, a lot of patients that come in that are on the internet come in like that. And years ago, I thought, oh my God, these people are nuts. I mean, I really thought they were. And they came in knowing more about this than I did. It's like, how dare you know more about this than I do? I'm the dentist. But they did. And they become what I call the hugs and cookies crowd now. When they come in, you sit down and listen to them. They go, my God, nobody's ever listened to me before about this, these symptoms. I said, well, we see it all the time. And then when we're done, they give you hugs, they give you cookies, they appreciate the work. The other thing about this is these folks come in wanting to get their dentistry done. They don't go, oh my God, I hate being here. This is the worst thing I could ever imagine. It's like, get out of here. But these people actually are joyous about being in the room to get their mercury fillings out. Now think about that. Thinking about a happy patient going, man, I love what you're doing. It's like, you are weird, But they're a great group of people to work with. And they do truly know more about it sometimes than I do. And they read a lot. Everything on the internet's correct, right? I don't care what it is. It's all right. And they come in with some really, still to me, crazy ideas. Okay, yeah, that's possible. That's possible. But they know what you're doing and not doing. So if you don't use the right technique, you don't put the vinyl dam on, if you don't put the suction underneath the dam, if you don't do blah, 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 they go, whoa, wait a minute, what about the oxygen? So they know. So if you mess up, and Kim can tell you out here, she gets calls from patients quite frequently from IAOMT members, not necessarily certified board, fellowed or anything, but just a member that didn't do it right. They'll call Kim and tell them about that. So, just be aware that these people know what they're doing. Now, the person person off the street doesn't necessarily, but the internet folks, they know what should be done. What else happens to 80% of the mercury vapor? This is what's important. When mercury binds to an enzyme, the enzyme no longer works. Now understand, enzymes are proteins with sulfhydryl or sulfur components to them. Mercury binds covalently with sulfur very tightly. So once the mercury is in the blood, it finds an enzyme, it's going to bind to that enzyme. Now you go to your doctor and say, you know, whatever it is, your thyroid enzyme or whatever one, they measure it, oh, you're fine. There's plenty of enzyme. But the enzyme is inactive because mercury is bound to it. So it's like a key in a lock. You know, it doesn't fit anymore. So it has no effect on its function. So it kills the enzyme. And that's not good. And a lot of these enzymes are detoxifying enzymes, which are designed to get junk out of our body. Now that they're bound with mercury, they no longer function. That's important. Essential facts on mercury exposure. Mercury is a neurotoxin, and any exposure is dangerous. I mean, any amount. The toxic effects of mercury exposure vary by individual. One or a combination of symptoms can present and can change over time. Coexistent factors influence the personal reaction. Like I said, everybody's different. Everybody reacts differently to a lot of different materials. I'm one of those very inactive persons. I don't react to much of anything, with the exception of poison ivy, and I don't get around that too very often anymore. It can take a number of years for symptoms to manifest, and previous exposure, especially if they were relatively low level and chronic, might be associated with delayed symptoms. So, you know, if you have a constant low level of exposure, you're going to have a problem. You know, people live in the chloroalcohol business or working that, making Clorox. There's a process they use mercury and sodium chloride and electrically charge it to get the chlorine off the sodium. That is a very, very risky. People who are making mercury switches, like for Honeywell or any aspect where people are working with mercury, the EPA and OSHA is all over these people with precautions. I mean, there's strict protocol what they have to do. In the dental industry, there's nothing. I ask our OSHA person, comes in once a year, what do you got news on update? Now, she's been coming for 15, 20 years. Nothing, we don't have anything. Like, we use 40% of the mercury in the United States, and there's absolutely no regulation of mercury in our offices. But you can't do that in a light bulb company. You're making fluorescent lamps. I'm telling you what, these people regulated, tested, everything's going on there. Doesn't make a lot of sense, but that's the way it is. Okay, this is a electromicrograph of a mercury filling. Now, what's it's showing here, I'm actually going to get up. This is, can you see that? Yeah, this is the mercury filling. And what you're looking at here, here, and here, a little bit there, that's globules of mercury that haven't been completely titurated into the amalgam complex. So as that filling wears down the surface up here from chewing or whatever, these mercury globules are exposed to the mouth and evaporate. And that's how you get the mercury vapor coming off these fillings.
So all mercury silver fillings leak substantial amounts of mercury constantly. The amount increases with any kind of stimulation, and as a result, mercury from fillings produces the majority of human exposure to mercury. The International Academy of Oral Medicine and Toxicology is extremely concerned about the anecdotal claims of safety by manufacturers and dental trade associations that are at variance with the published peer-reviewed scientific evidence to the contrary. The precautionary principle requires action once the possibility of harm exists. It does not require proof beyond a shadow of a doubt that in the case of heavy metal and xenobiotic exposure is both nearly impossible and unnecessary, in our opinion. What you're seeing is mercury vapor coming off a 25-year-old silver amalgam filling in an extracted tooth. The background is a phosphorescent screen. The mercury vapor absorbs the fluorescent light, and you can see it as a shadow on the screen. This is mercury coming off a filling that was dipped in water that's the same temperature as the human body. This is a filling that was rubbed with a pencil eraser for just a few seconds. Like going to the hygienist and having her clean your teeth. These are not small amounts of mercury. If you can see it, it's more than 1,000 times higher then the Environmental Protection Agency will allow for the air that we breathe. What about the last time you went to the dentist and they drilled on your tooth? Here is the mercury vapor every time you raise the temperature to 110 degrees with hot coffee or warm water, or even chewed on it. Mercury comes off fillings every time you stimulate them, and that stimulation causes the mercury to continue to leak out of the fillings for an hour and a half at a minimum. Some people grind their teeth. Some people chew gum.
All right, that was David Kennedy. Thank you, Dr. Kennedy. All right, this is an interesting chart. This is the published estimates of the mercury exposure in adults with dental amalgam fillings. And the red line right there is the U.S. EPA guideline. That's the maximum amount of mercury you're supposed to have. And I think it's a 24-hour period. And if you look on that, all these studies, with the exception of two, the EPA, or the mercury vapor exposure, is way over the EPA's tolerable limit. Mark Richardson, which is a Canadian scientist, basically, that goes deep into this stuff, more than 67 million Americans aged 2 years and older exceed the intake of mercury vapor considered safe by the U.S. EPA. So that's 122 million Americans exceed the intake of mercury vapor safe by California. Now, this slide's probably 10 years old, so I imagine that number's higher today because our population's grown. Individual response to dental mercury exposure is based on personal circumstances. And I'll tell you, I got in a little trouble with the North Carolina board, one of my colleagues, because in my email, my website, I had posted this kind of information on a couple pages, all of the assumed problems people could have with mercury vapor. Well, the board had a fit over that, so I had to take it down. I've been in there twice, never for patient complaint, just because of my advertising. I had an article in one of our local little, community magazines, kind of with this kind of information, and I had to go down to the board again and apologize, and with attorneys both times. Wound up both visits cost me $20,000 to defend myself against scientific research. But you know what? You get in there, and there's one guy who's got the highest chair. It's like me up here, only the bench is higher. And then you're sitting down there, the peon, with your attorney, and there's not one face up there that's happy with you. Everybody thinks you're the devil. So, don't go there. Don't point them. You can't fight the Fed. You can't fight your board. Some boards are more lenient than others. But just keep it under the wire. Just don't say things like this to a patient or ever promise them they're going to get better from whatever symptom they have. You don't know that. You can't. Don't ever say, the mercury's causing this symptom. You don't know that. It could be, but it's not our job to do that. That's physicians. Okay, dental mercury amalgam pregnancy. Increase the number of maternal mercury fillings. Increase mercury level in fetus and infants. So what's in the mom is in the baby. Crosses that placental barrier. Increased number of material mercury fillings. Increase mercury in the breast milk. So that's something. If mom wants to get pregnant, it'd be wise for her to get her mercury fillings out first. There's a lot of controversy of whether autism is responsible for this, or if it's the mercury in the thimerosal in the preservative for the virus or the vaccines these kids get multiple doses of. And the school's out yet. It could be a combination of things. We live in a very toxic environment. Fluoride could be linked to it. Who knows? Hopefully someday we will. And oral galvanism. I graduated from dental school in '79, and our professors at the time talked about oral galvanism and say never ever leave a mercury filling underneath a metal crown, gold crown, PFM. I see it all the time today when I remove an old PFM. There's a mercury base underneath that. But this is just showing a gold onlay next to a mercury filling, and it creates a current. I don't know, you guys aren't old enough to remember Johnny Carson perhaps, but Lucille Ball was on there one time. And as you know, Johnny was one of the best interviewers and one of the funniest guys I think has ever been on TV. But he was interviewing Lucille Ball, and she came up and said, I hear radio signals a lot. He said, what do you mean? In my head. Well, that set the whole audience laughing. Johnny almost fell out of his chair. But what Lucille Ball was talking about, nobody knew anything about it at the time, is the galvanic reaction. Other people have reported this. So if you got a bunch of mercury fillings and different other metals in your mouth, that creates a battery. And that could be what she was talking about. Allergies to dental mercury and other dental materials, approximately 21 million are likely allergic, just allergic to mercury. Most dental patients are not tested for metal allergies. There's testing you can do. We don't do it routinely because we just get them out of there. Health conditions linked to dental mercury allergies include autoimmune disorders, fatigue, multiple chemical sensitivities, lichen planus. You know, I don't know if mercury is the only one that does this. There's probably other agents too. Again, we don't tell people this is what you're causing your lichen planus, but we know there's a good chance of it. Number of patients with health linked to dental metal allergies improve or recover after the removal. Oral galvanism, as I said before, has been linked to dental mercury allergies. There's a battery going on. We used to think mercury tattoos were the aspect of the high-speed drill grinding this mercury out and sending it into the soft tissue. Well, it's galvanism that's causing that. There's going to be, if you get an amalgam tattoo underneath the crown, I bet you anything there's mercury underneath that crown. It's carrying a battery, and that's where the mercury is being deposited. This is the biocompatibility test I mentioned earlier. We don't do it on all of our patients. This company is now out of business. Jeff Clifford died a couple years ago, but we have other people take the place. But they give you back a book. Used to send you the book. Now it's on internet. But there's probably 3,000 different materials for everything, and you get on this report you get an NS or an S, meaning safe, not safe or safe. And the assistants go through and mark whatever we can use. I just gotten to the point now where we know what to use and what not to use. Very unusual to have a patient that was going to react to something that we didn't know about. While dentists do not prescribe pharmaceutical drugs or supplements for mercury testing or detoxification, it's important for them to understand the test and the protocol. That's your physician's job. A growing number of patients are seeking out biological dentists to remove the mercury fillings. So that's the truth. But I mean, we let the physicians, they refer to us, we refer back, and we let the physicians dictate, chelation treatments. We don't do any of that. Never tell a patient they're going to get better. Never tell them it's caused by that, anything like that. We stick strictly to dentistry, and that's the safest place to be. Because your board really have a problem with you if you start becoming a physician in a dental office. Heavy metal testing and chelation. There are a variety of tests for mercury, other heavy metals, and there are a variety of chelation, detoxification protocols. These tests, again, I'm going to call it the Clifford test, although it's been bought out by a different guy, Dr. Jaffe. They'll come back with a whole list of heavy metals: molybdenum, cadmium, beryllium, aluminum, all of them. Then they give a bar graph on how high they are in each category. So they're very easy to read. And there's different tests that you can use. There's hair analysis, which I don't find very accurate because, people are either secretors or non-secretors. If you're a secretor, it means you're getting rid of toxins. That's great. It comes out in your sweat, comes out in your hair. If you're a non-secretor, you go in and get your hair tested. There's nothing in there because you're not getting rid of it. That's bad. If there's mercury in your body, you want it in your hair because that means it's coming out. So some of these tests, other people believe in them. I just do what I've been doing, and it seems to work fine. Biological dentists should learn about these tests to better serve their patients. Many patients ask dentists for referrals to practitioners for mercury toxicity and detoxification, which we do. They refer in, we refer out to physicians that know what they're doing. Dental amalgam results in substantial quantities of toxic mercury released annually into the environment. Remember I talked about the sewers, 40% or 60% in the water systems. But what you got to understand is once you put a mercury filling in a patient's mouth, it's in the environment. Okay, they're exhaling mercury, they're inhaling mercury, they're taking mercury home to their family. When you remove the mercury filling, now again, this mercury is going to go into the environment, either into the water system or into the air. When the patient dies, that mercury either goes into the ground in the casket, or because cremated, goes into the air. So once you put it in your mouth, you might as well just throw it out in the field and let it be absorbed into nature. And some of the ways we have to deal with this, now this is something that I thought was really a cool idea 25 years ago. All the sewer sludge goes into a common septic area, you know what I'm talking about, some sewer plant. And they take all that, they dry the sludge down, and they either incinerate it or they put it on farm fields because, like fertilizer. But all those toxic metals, I don't care what is in there from industry and from everybody, goes back into the soil or into the plant, into your corn, and there's back in the environment again. So it's not a good idea. Now, these are mercury separators, and I've had one for, oh my God, since I joined the IAOMT many, many years ago. And there's different styles. I have the one on the top there, but they all work very well. And like I said, they're supposed to take out 99%. What we do, Dr. Taylor and I, she just bought my practice in July, and she's taken over that and my building too, I'm happy to say. So I'll be retiring in end of December, my plan. Yeah, I like a house up in Smith Mountain Lake, Virginia, and it's calling me. My fiance is retired. She's a lot younger than I am, as I said, but I mean, it's, I've had, 43 years. I've enjoyed it, but, time to do something different. Time to travel, enjoy life. You don't save all that money in retirement and die the next day, at the chair. Hopefully, when you retire, should be a start of another life, so I'm looking forward to it. And I'll still be here. I'll still be doing this if they have me. Which separator is right for you? Well, I don't know that it matters. I mean, both of these systems work for some high-volume dentist friends of mine. We do change it's our collection basket. Let me see if I can go back here underneath this thing. Yeah, see this? Oh, darn it. Push the wrong button here. Right there. Okay, that's where the mercury is collected. And you got to send, to ours goes to Seattle, Washington, but other companies would do something different. But they take that material and they dispose of it, theoretically, safely. I'm trusting them to do that, but we pay them to do that, so I hope that's the case. Kind of like recycling, I wonder how much that just goes into the trash, and doesn't get recycled anyway. I'm a big recycler. I drive people nuts at the office and go around. I'm taking out soda cans and plastic bottles from the trash, and cardboard boxes and taking them over to recycling. I don't know. Maybe I'm doing my part. Maybe I'm nuts. The latter's probably got a lot of truth to it. All right, occupational exposure. Dentists and dental professional, dental staff, and dental students are occupational chronically exposed to mercury. I kind of hit on that earlier. I had a friend who, several years older than I am, and I used to practice with him years ago, but he was a fastidious dentist, very, very good dentist. But he would bring his patients back in after he placed amalgams and polish them all. And he was so proud of how shiny these things were. I go, Bob, what the hell are you doing, man? Because even hygienists, this is important for you guys. My hygienists never take a polishing brush or a cup on a mercury filling. You just don't. You do the tooth, but you don't do the filling because the mercury vapor comes off of that. So be careful with that. So at any rate, and again, we're sitting there all day. The assistant and the dentist are sitting there all day. The hygienist, not so much, but you're working around it. And it's in the ventilation system, so even the front office is bothered by it, or could be. Okay, this, again, I talked about hygiene. During removal of mercury filling, that's the big deal, removing of them. Placing them, a little bit, but when you remove one of those puppies, the room is full of mercury. And we've tested this stuff. We know. I'll show you a slide later on that I was involved with in Joe Palmer's office in Greenville, South Carolina. And here's some OSHA information. That's 100 micrograms per cubic meter of air is the daily limit. Now that is like a high exposure. And what this is showing, opening an amalgam capsule, I don't know if you guys titurate amalgam anymore, but 400 micrograms. Opening a chairside trap, 600 micrograms. I gave my Patterson guy a mercury mask that we use, a respirator, so when he opens traps in anybody's office, he puts that on. I hope he puts it on. Drilling with no water spray, 1,200. Drilling with water, better, 100, but that's still a lot. Drilling with water and suction. And the point is, you touch a mercury filling, there's a lot of mercury. It is apparent that the single largest source of mercury exposure to the practicing dentist is removal of old mercury fillings. I think I've hit on that. And what we do is we use a lot of water spray. We cut them in big chunks, as big as we can to get it out of there. In other words, you don't want to grind the whole thing into a mercury slurry. You want to get it out in chunks as best you can. So that's important to do. Now, this is something that I worked with Joe Palmer, and Dr. Young, unfortunately, is not with us anymore, and Dave Warwick down in actually Greer, South Carolina. And what we did, we took a mannequin and we put mercury fillings in their teeth, okay? And then what we did is we removed them we had industrial hygienists there with us to measure the mercury coming off. And the test was to see how much splatter on the patient's chest from particles of mercury, not droplets of water, but just, you know, pieces of metal. And what we found out, we did it with no water at all. We did it with water. Then we started implementing our system of doing it, and we found that, you know, the worst possibly could be we'd take them out without any water. But then we went to our highest standard, and it was much, much less mercury exposure. And this was done with industrial hygienists measuring everything we were doing. We had 2 of them in there. And boy, were we happy to get out of that room. This is a little blur protocol we use. You can see that big white hose. That's our evacuation hose. You got a vinyl dam on. We got suction underneath the dam. The patient's on oxygen. We're on our respirators. So, and we got behind us, we got another mercury removal system.
So the results of the study basically confirm that we are underestimating a source of mercury, and it can have massive implications on how dentistry is practiced. The amount of particulate that comes off of these dental fillings when they're drilled is monstrous. And unfortunately, in a regular practice, this particulate is not treated as anything that's of significance. So it changes how we think about doing things, and in this case, we'd want to mitigate any possible exposure to both the dental worker and also the patient. So it means completely respecting that exposure, removing it from the office as quickly as possible, knowing where this material can land, and maybe even the design of the dental operatory itself and how we handle this material. We also have to understand and respect the fact that mercury vapor is absorbed via the skin. So that means that skin has to be protected from this source. So any possible skin exposed to this particulate has to be covered by some form of barrier that is resistant to mercury vapor getting through it. The implication of what we found in this study goes to the practices making changes in how we protect especially our staff. This is an occupational matter. If you understand that when you do drill out mercury fillings, that this particulate is being spread out all over the place. Some of the important areas that we have to consider especially are in the dental workers' wrists, their hands, their forearms for sure, and understand that this exposure is an everyday occurrence that may happen 3 or 4 times a day. So we have a big problem, and we have to start recognizing that this particulate, this waste, is a big deal. And the first step, in my opinion, to trying to mitigate this exposure is to stop putting it in the first place. We have to start looking at the alternative materials. They're safe, they're effective, they have longevity, and if you consider the environmental impact and the cost of use through its life, amalgam fillings are the worst and most expensive material that we can think of using.
All right, that's David Warwick. He's one of our Canadian dentists, and you know, Canada or U.S. is still not letting them in without vaccination, and they sure as heck aren't getting vaccinated, so we miss them. Duplinsky, he's a professor at Yale Dental Department, and he came out with a report several years ago that said retired dentists have the highest prescription rate for neurological problems and heart problems. I don't know. Maybe it's mercury. Maybe it's I don't think it's a stress of the thing. We're used to doing that. Common reasons for mercury removal: device failed, cosmetic, patient preference, allergies to mercury. And again, we talked about the dangers of removing them. Secondary exposure is less obvious than mercury exposure. We talked about that. Environmental exposure caused by the waste, mercury vapor from sterilization. That's something a lot of people don't think about, is that when you put dirty, I'm going to call them dirty instruments that haven't had sulfur sprayed on them in a compound, that mercury goes in that autoclave and it vents out into the office. So these things need to really be demercurized before they go into the autoclave. And mercury on clothing, carpets. I mean, if you go home and what you worked in today, you got mercury vapor, you got mercury particles on you no matter how much precaution you've taken, and you take that home to your family. First thing I do when I get home is take a shower, and I wear scrubs in the office and put my street clothes on, when I come in the morning, when I go home at night, and I don't carry it out any more than I have to. This is a SMART program that is one of our least or less accredited systems. We have, SMART, then we have accredited, then we have fellow, then we have master, depending on the level that you've decided to achieve in the academy. But this at least lets patients know you're paying attention. So this is something you might want to go ahead and get done real quickly, and then later on maybe become associated or then mastered or fellowed. Built upon years of clinical research and experience, IAOMT published PubMed literature and went through and determined that this is one of the easiest ways to get to the point where you at least know what you're doing and the patient can understand that. This is Griffin Cole. Oh, wait a minute, didn't play. Hold on, let me write his name.
I'm Dr. Griffin Cole of the International Academy of Oral Medicine and Toxicology. Patients and dentists should make sure that each step of the safe mercury amalgam removal technique, or SMART, will be applied during a dental appointment for filling removal. The first step is for patients to consult with their dentist before the mercury filling removal begins, so that both the patient and dentist agree that all safety measures will be in place. This helps to ensure that the patient and dentist know exactly what to expect. It's also helpful to watch the following example of the safe mercury amalgam removal technique, or SMART, being applied. Each room where mercury fillings are removed should have adequate filtration in place, which requires a high-volume air filtration system such as IQ Air Dental Mercury FlexVac or similar device, capable of removing mercury vapor and amalgam particles generated during the removal of one or more mercury fillings. If possible, windows should be open to reduce the mercury concentration in the air. The patient should be given a slurry of charcoal, chlorella, or similar absorbent to rinse and swallow before the procedure, unless the patient declines or there are other contraindications making this clinically inappropriate. Protective gowns and covers for the dentist, dental personnel, and the patient should be in place. All present in the room should be protected because substantial quantities of particles generated during the procedure will elude collection by suction devices. It has been demonstrated that these particles can be spread from the patient's mouth to the patient's knee and to the chest, shoulder, and neck of the dentist and dental assistant. Either a properly sealed respiratory grade mask rated to capture mercury or a positive pressure properly sealed mask providing air or oxygen should be worn by the dentist and all dental personnel in the room. Non-latex nitrile gloves should be utilized by the dentist and all dental personnel in the room. Face shields and hair head coverings are to be utilized by the dentist and all dental personnel in the room. In order to protect the patient's skin and clothing, a full-body impermeable barrier should be utilized. External air or oxygen delivered via a nasal mask for the patient also should be utilized to assure the patient does not inhale any mercury vapor or amalgam particulate during the procedure. A nasal cannula is an acceptable alternative for this purpose as long as the patient's nose is completely covered with an impermeable barrier. A saliva ejector should be placed under the dental dam to reduce mercury exposure to the patient. A dental dam that is made with non-latex nitrile material should be placed and properly sealed in the patient's mouth, as well as a full head, face, and neck barrier that is under and around the dam. During amalgam filling removal, the dentist should utilize an IQ Air Dental Mercury FlexVac or similar device in close proximity to the operating field, that is 2 to 4 inches from the patient's mouth, to mitigate mercury exposure. High-speed evacuation produces better capture when fitted with a cleanup device, which is preferred. Copious amounts of water to reduce heat and a conventional high-speed evacuation device to capture mercury discharges should be used to reduce ambient mercury levels. The amalgam should be sectioned into chunks and removed in as large of pieces as possible using a small diameter carbide drill. Once the removal process is complete, the patient's mouth should be thoroughly flushed with water and then rinsed out with a slurry of charcoal, chlorella, or similar absorbent. During the opening and maintenance of suction traps in operatories or on the main suction unit, dental staff should utilize the appropriate personal protection equipment described earlier. An amalgam separator should be properly installed, utilized, and maintained to collect mercury amalgam waste so that it is not released into the effluent from the dental office. Dentists must comply with federal, state, and local regulations addressing the proper handling, cleaning, and/or disposal of mercury-contaminated components, clothing, equipment, surfaces of the room, and flooring in the dental office. I hope that you'll make the smart choice about your dental care by asking for safety measures during your mercury filling removal. For more information about the Safe Mercury Amalgam Removal Technique, or SMART, including scientific research about why these safety measures are important, visit thesmartchoice.com from the International Academy of Oral Medicine.
All right, I've got a few more slides. I might run a little bit over. We're going into a break after this. Is it okay if I take a few minutes of break and finish? I got 10 slides to go. Okay, good. Okay, again, this is what Griffin was talking about: slurry of charcoal, chlorella, full body impenetrable barrier, and external air on the patient. The other dental dam made with non-latex material, because mercury vapor goes right through latex. If you're wearing latex gloves or latex dams, the mercury goes right through that. There's no barrier whatsoever. It won't go through vinyl. Saliva ejector placed under the dental dam. Copious amounts of water, as I said, cut this mercury into chunks and bring it out that way, and then rinse the patient's mouth with what would suggest. We use vitamin C and N-acetylcysteine. We make it up in the morning and have the patients rinse. In the beginning, we have them rinse and swallow, and then at the end of the procedure, we have them just rinse and spit. Protective gloves covering, again, it has to be a vinyl product. Do not use latex. And this is an example of some of the shields we use, and they're available, some of these at the IAOMT. This is the one I use, been using it for years, and there's replaceable filters on both sides of that, and that will remove the mercury from the air you're breathing. Smart office environment protection, amalgam separator, as we talked about, high volume filtration. If possible, open windows. We can't do that, but wish we could. Compliance with federal, state, and local regulations. Alternatives to amalgam is composite or CERAC or porcelain restorations. We found today that composite restorations are as durable as mercury was years ago, and a lot less reaction. But make sure when you do that, we use only Voco products with no bisphenol A, because patients will ask you about that. They do not want bisphenol A in their products, in their dental restorations. Controversial, as a bisphenol A, yep. Amira, which is a Voco product, is very good. And alternatives to that, concerned about glass ionomers. Well, we're not a fluoride positive organization. We're very much against fluoride. So these glass ionomers and compomers have fluoride in them. We use biological testing, as we talked about. And this is the SMART program, which I hope you guys will consider going through. It's a relatively simple process, but at least lets the patients know you are aware of what's going on. Just being a member of the IAOMT does not really give the patient a whole lot of a confirmation that you know how to do this. And that's it. Well, I thank you guys. I thank you for your attention. Thank you very much. And enjoy the next 2 days. It's going to be good.